Kerendia contains the active substance Finerenone. Finerenone works by blocking the action of certain hormones, mineralocorticoids that can damage your kidney and heart. Kerendia is used for the treatment of adults with chronic kidney disease, stage 3 and 4 with abnormal presence of the protein albumin in the urine associated with the type 2 diabetes. Chronic kidney disease is a long-term condition. Your kidneys keep getting worse at removing waste and fluids from your blood. Type 2 diabetes is when your body cannot keep your blood sugar levels normal. Your body does not produce enough of the hormone insulin or cannot use the insulin properly. This leads to a high level of sugar in your blood. Indications. Kerendia is indicated for the treatment of chronic kidney disease, stage 3 and 4 with albuminuria, associated with type 2 diabetes in adults. How to use. Always take this medicine exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. How much you have to take. They recommended that the maximum daily dose of this medicine is 1 tablet of 20 mg. Always take 1 tablet once daily. Each tablet contains 10 mg or 20 mg Finerenone. The starting dose depends on how well your kidneys work. To check this, your doctor will test your blood. The results help your doctor to decide if you can start with 1 tablet of 20 mg or 10 mg once daily. After 4 weeks, your doctor will test your blood again. Your doctor will decide on the correct dose for you. This might be 1 tablet of 20 mg or 10 mg once daily. Your doctor may also tell you to interrupt or stop taking Kerendia. Your doctor may decide on changes in your treatment after testing the blood. How to take this medicine. Kerendia is taken by mouth. Take Kerendia at the same time every day. This makes it easier for you to remember. Swallow the tablet whole. You can take it with a glass of water. You can take it with or without food. Do not take it with grapefruit juice or grapefruit. If you cannot swallow the tablet whole, you can crush it. Mix it with water or soft foods such as apple sauce. Contraindications. Kerendia is contraindicated, high levels of potassium in the blood. A patient who is producing milk and breastfeeding. Chronic kidney disease with likely reduction in kidney function. Precautions. Before taking Finerenone, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reaction or other problems. Talk to a pharmacist for more details. This drug may make you dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Kerendia side effects. The most common side effects include hyperkalemia, potassium level in your blood that is higher than normal. Hypertension, blood pressure that is lower than normal. Hyponatremia, sodium level in your blood that is lower than normal.